So I'm Dave McDaid. I work here at the Care Policy and Evaluation Centre, doing a range of research around mental health and public health policy. And one of the areas that I've focused on quite a lot over the last 5 or 6 years now has been looking at the importance of addressing the challenges that are faced by refugees and displaced people in terms of their mental health, but also some of their wider health issues as well. And of course, you don't have to go very far to see how important this issue is now with the issues in Ukraine and so forth, and the numbers of displaced people from Eastern Europe. But when we started the project, we were focused on the Syrian conflict and huge numbers of refugees that had left Syria, particularly going to places in the near Middle East, such as Turkey and Lebanon. Really big challenges for those societies in terms of just numbers of people to support, but also we've been looking at how the mental health needs of refugees in Western Europe have been supported as well. So this has been a big European project led actually by colleagues at the University of Amsterdam, and we've evaluated interventions, brief psychological interventions intended to deal with issues such as trauma, depression, anxiety that are experienced by people who've had to flee conflict or just lost their homes and seen terrible things. And then critically, these are delivered by people usually of Syrian background themselves, delivered in Arabic, similar lived experience, culturally adapted, culturally sensitive interventions, co-designed, co-produced with refugees. And really, we've been evaluating these. We've looked at their effectiveness, their cost effectiveness, and the results are pretty positive actually in most settings, not all. I think there are some challenges, but certainly where you deliver these things, you can deliver them in group-based interventions or individual. We've had to do it online as well as in physical face-to-face environment because of COVID. We had to change our strategy there. And we find that it does have certainly a short-term impact on the mental health needs of people with a refugee background, and also appears to have some impact on health service utilisation. And here, critically, it helps people to increase use of health services. And in fact, what we see in the past is one of the challenges for refugees is because they literally are displaced from the society they're in. They don't use services in the way they should, and actually a more fundamental challenge, and I think this is a broader context for the work we've been doing, is that refugees fall between the cracks. They're often not covered at all by healthcare systems in Western Europe. They certainly have very limited coverage in the Middle East and places like Jordan and Lebanon and Turkey. So there's a real challenge as to who's actually going to fund services, and also the sensitivity about making an argument for investing more money in a population who may not necessarily be there all the time, or they may not always be welcomed as well as they should be in some settings. But it's really critical now, when we have World Refugee Day coming up, that we think more about these issues for a group that I've already said fall between the cracks. They are among the most marginalised of groups. They may have language and cultural barriers to participation in society. There may be a lot of animosity and prejudice that they experience. And there are practical issues as well about, particularly the Syrian refugee population, that there are different groups that don't necessarily trust each other as well. So you've got that challenge as well. They're not a single kind of group. So it's really important to think of these issues and think about how it's not only in the interest of refugees to improve their mental and physical health, but it's actually in our interests as well. And it's certainly in the interests of helping aid in recovery, both helping people go back to their homes where that's possible, or helping them integrate into a new society where inevitably that is the case, which is also important for Ukraine and other conflicts, no doubt, sadly, we're going to see in the future.